Welcome to the deep dive.
Great to be here.
Today we're looking closely at something really important, home care. After a deep vein thrombosis, or DVT, we've got excerpts from a couple of sources for this, a deep vein thrombosis protocol and also a doctoral discharge protocol. And that second one actually includes a specific legal disclaimer we need to mention later.
Right.
So our mission today is really to pull out the key steps, the advice from these specific sources, just so you can get a picture of what managing DVT at home might look like, according to this particular material.
And it's worth stressing, like you said, one source is very clearly a doctor's own protocol. It even says it should be discussed with your doctor.
Exactly. So this isn't medical advice for you. It's a deep dive into these documents. Okay, let's unpack them.
Absolutely. So looking at this material, that initial phase, say the first 2 weeks, it's described with some really quite specific instructions. First off, medication. It's hammered home. Strict adherence is crucial. Taking prescribed anticoagulants, they mention warfarin or rivaroxaban specifically right alongside any other chronic meds you might be on.
So number one is stick to the medication plan precisely.
Precisely. They see it as critical for stopping more clots.
And what about activity? The sources seem big on rest, especially at the start.
Yeah, very much so. They state pretty clearly, avoid strenuous activity for the first 4 weeks. And elevate your legs frequently, above heart level.
How specific do they get about, like, sitting or standing in those first few days?
Oh, incredibly specific. It's actually quite striking. For days 1 to 3, the advice is don't sit or stand still for more than 5 minutes every 6 hours.
5 minutes? Wow.
Yeah, the guidance is basically lie down, legs up, as much as humanly possible. Then, days 4 through 14, it eases up just a tiny bit. You shouldn't sit or stand still for more than 15 minutes every 4 hours.
Still mostly lying down with legs elevated then.
That's the emphasis, yes. Lie down, legs up, whenever you can. It really shows the focus on reducing that static pressure early on.
Okay, that's super detailed. And compression, is that part of this initial bit too?
Yes, right from day 1, according to these protocols, you're advised to wear compression bandages 24 hours a day.
24/7.
Until the swelling, the edema goes down. After that initial swelling is managed, the sources say to switch to compression hosiery. And here's a key thing. They recommend wearing that indefinitely.
Indefinitely. Okay, that's a major point for the long term. So after those first 2 weeks, what do these sources say about ongoing long-term maintenance?
Well, this is where you see the commitment really laid out. The advice is to keep wearing that compression hosiery daily. For at least 6 months is the minimum mentioned, but ideally, like we said, indefinitely.
And still elevating the legs?
Always. Whenever you're resting or sleeping, elevate those legs. That's a constant theme.
Right. And exercise. Does that change from barely moving to something more active?
Exactly. Daily exercise becomes a really key part of the long-term picture in these sources. Walking, cycling, swimming, they're specifically mentioned. Good for strengthening calf muscles, you know. And they suggest a full exercise program can usually resume after about 4 to 6 weeks. Beyond specific exercises, though, they also really stress long-term weight control.
Oh, big management.
And, crucially, stopping smoking. They frame it as essential, not just for vascular health, but overall health, too.
Okay, so if we were to sort of boil down the consistent advice from these sources for managing DVT at home, it sounds like. Elevate your legs when resting, control your weight, definitely stop smoking, exercise daily, wear that compression hosiery, and take your anticoagulants exactly as prescribed.
That sums up the core recommendations pulled from this material really well. And they also mention warning signs. They advise contacting your doctor's office if you notice any new or worsening issues, like with your legs or any wounds, or if any sudden new symptoms pop up.
Right. Always important. Now, we absolutely have to circle back to the source of this information, especially that disclaimer. Yeah. Pulling this directly from the doctoral discharge protocol, it clearly states, and I'll read it, legal disclaimer. This is a discharge protocol written by Dr. Gregory Weir for patients managed by him at his practice at the Life Eugene Reyes Hospital. The contents should be discussed with your own doctor and should not be considered as advice if you are not a patient of Dr. Weir.
Very clear. So it's his protocol for his patients.
Exactly. So putting this all together, what's the takeaway? Based only on these documents we've looked at, managing DVT at home requires, well, a lot of consistent effort.
Definitely. Across several areas. Meds, those very specific initial activity and positioning rules, and then that ongoing long-term commitment to things like compression and lifestyle changes.
Yeah, the sources give these clear, sometimes surprisingly precise timelines for the early restrictions, and then really emphasize that long-haul stuff like indefinite compression and daily exercise.
And just to underline it one more time, this deep dive is purely an exploration of the material provided to us, including that protocol which explicitly tells you to talk to your own doctor.
Right. Which kind of leads to a final thought, doesn't it, stemming from this material.
Mm-hmm.
Given the source's emphasis on these really long-term, maybe even lifelong commitments, like wearing compression hosiery every single day, big lifestyle shifts, well, it makes you wonder, how do people actually maintain the motivation? How do you successfully integrate these things into a sustainable daily routine for the long run?
That's a really practical question, isn't it? Something definitely worth thinking about as you process this information from these specific protocols.